What are the red flags for sciatica? This is a very important video to watch if you are suffering with sciatica, as you need to make sure that if it does become serious, you're doing the right things to ensure it doesn't cause any long-term issues. My name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with back pain and sciatica every single day to get back to living their lives and back to the things that they enjoy doing. So, what is sciatica? Well, sciatica, if you are suffering with it, is a trapped nerve in the base of the spine that runs down the back of the leg. It can be severely debilitating, extremely painful, and can really cause problems for as long as 6 months, often up to a year. It can be a recurring problem that keeps on coming back, and there can be no rhyme or reason as to why it happens. So, what are the red flags? What do you need to be watching out for, and when do you need to be seeking professional help, and how do you know when you can't manage it yourself? The first thing to look out for is obviously pain in the leg. Now, pain in the leg is a very common symptom of sciatic pain. So let me show you on this model here. I've shown this model quite a few times, but this is the first time watching the channel. Let me run you through it. So essentially these are the bones. This is a section of your spine. These are the knobbly bits here you feel on your back. The yellow bit is the spinal cord. And then you have your nerves coming out the side here, and the red bit is obviously the disc. So very often sciatica is caused by a prolapsed disc. So where the disc bulges like that, you see it presses on the nerve, and that's going to be the nerve that runs down the back of the leg. That's going to cause pain, electric shock, pins and needles, achiness, pins and needles, and it can be very, very debilitating. What can often happen is where the disc, it pushes out the side, that's okay. That can be managed effectively from home. You may need some help from a professional, including an osteopath, a chiropractor, to help get pressure off that disc. But generally speaking, we call it a lateral disc. That can be self-managed. Now, a central disc. So if the disc decides to come out the back, so right out the back and affects both legs, starts to cause pain down both legs, then we need to be thinking, okay, this could be something that's more sinister, and there's a risk of something called a cauda equina syndrome. So cauda equina syndrome, you may have heard the GPs or the medics talk about that. If you have struggled with sciatica and gone to your GP or gone to the A&E department, they will always ask you questions that I'll go through in a second, because they are worried about cauda equina syndrome. So what is cauda equina syndrome? Well, cauda is cord, so it's Latin for cord. Equina is horse's tail, and then syndrome is the condition. Where you get to the base of the spinal cord, you can see here, it's nice and thick. This area here, and that runs from base of the neck all the way down. And when it gets to the bottom of your spine, it starts to fray into lots of little strands, aka horse's tail. And it branches out through the holes in these bits here, and it goes down to the back of the legs. So if this gets trapped by a central disc, it can cause long-term issues. The thing they're worried about is paralysis of the legs, full paralysis of the legs, which is non-reversible. That's what they're really, really concerned about. So they always say, if you are getting the symptoms that I'll tell you in a second, then you need to get yourself to an A&E department very quickly. What would those symptoms be? What are they concerned about? Well, they're worried about something called saddle anesthesia. So what is saddle anesthesia? So let me show you. You've seen a horse rider? A horse rider will sit onto a saddle. So the saddle will sit in between the groin here. It will go up around to the buttocks. That's where the saddle will make contact. So anything in the groin, anything going round to the back of the buttocks, anything underneath, that will be the saddle. So if that is ever numb, if there's ever no feeling on it, then that is a red flag for sciatica, and that's going to need immediate professional help. Get yourself off to A&E. So if you find yourself struggling with back pain, you're getting shooting pain down one leg or both legs, and you're getting saddle anesthesia, then I would get yourself off to A&E as quick as possible and find out what is going on. Now, how do you know if you've got saddle anesthesia? Well, a couple of things they ask you is, well, when you're sitting down, can you feel your buttocks on the seat? If you are going to the toilet, can you feel the paper around your bum? If you can't, then that's a problem. And also when you're going to the toilet, can you feel the flow of urine coming through? So if you can't, then again, that's a problem. If you ever find yourself incontinent, so if you find yourself, oh my gosh, I needed a toilet and I wet myself, then that again is a medical emergency. You need to get yourself off to A&E straight away, so they can try and decompress the cord. If there is a cauda equina risk there, they can get you sorted out straight away to avoid any problems coming with the legs. So those would be the things that a medic will tell you. Those would be the things that the A&E department will tell you. If you ever get any incontinence, any sort of numbness, or the lack of feeling when you're going for a number 1 or a number 2, can't feel the paper on your bottom when you're wiping, then yes, that would be an absolute medical emergency that we need to make sure we're getting you off for. Now, what are some of the other things that can determine the level of severity in terms of your sciatica? Well, one thing we always test for here is a slump test. So let me show you. So we get our clients with sciatica to sit on the edge of the bed, and what we'll do is we'll ask them to extend their good leg out, so the leg that doesn't have any pain. You can do this at home as well. So if they extend their good leg like this, so say I've got pain on this is my left leg. So I've got pain on my left leg here, and this one is the good one. Now if I'm lifting my leg up like this and it's causing pain down either of my legs, then we may have a problem. It could be more of a central disc, it could be bringing the pain across like this. So I'll repeat that. If I'm lifting my good leg up and it's causing pain to come down my good leg, or it's causing pain to go down my bad leg, then there could be more of a sinister disc going on there. We need to be careful with. Not an emergency, but we just need to be careful with. Definitely get yourself off to a chiropractor, an osteopath, a GP, someone that can help you to get more of a clear diagnosis. Good leg comes up, nothing, fine, okay, good. Pull the toes towards you, nothing, fine, and then bend the head like this. Be very gentle with this one. You want to make sure that you just take it nice and slowly. If there's nothing there, that's fine. Let's move across to the bad leg. So bad leg, sciatic pain all the way down the leg to the ankle, rated as a 10 out of 10 pain. Generally speaking, you lift that leg up just to hear the patient is going to feel some pain coming down that leg. You don't need to do any more than that. We know there's going to be tension on the sciatic nerve. If they lift their leg up and they think, oh, there's nothing really there, I would encourage them to try and pull the toe towards their head. Nothing there, that's fine. And then bend the neck like this. They may get some tension on the sciatic nerve. They should be feeling something by now. If you're not feeling anything like that, then it could be that the referral pattern is coming from something different. It could be coming from a muscle, it could be coming from a joint, and maybe not the actual true sciatic nerve. It could be something different, piriformis syndrome, and we need to look into that further. But if you have got a true sciatica that's being compressed by a disc, then usually just lifting the leg up like that will cause tension on the sciatic nerve, and you will be feeling it. But the great thing I love about the slumps test is that you can use it to track your progression, your healing as you go through. So you may, at the start of your journey, where you've had sciatica for a week or 2 weeks, do this, and you literally can't lift your leg more than 45 degrees. But another 2 weeks go by, you can get it up to 90 degrees, you can then start to pull your toes. It gives you an idea that the tension on the sciatic nerve is starting to reduce, which is a really nice way to do it. Another one we test for here as well, again, not for a red flag, but just for finding out where the severity of the sciatica is we do a straight leg raise. So we will lift the client's leg up like this, and you get someone to do this at home. And if it's causing pain to go down the leg, then we know, okay, at 45 degrees here, there's pain. Now we would test that again in 2 weeks time and get them to lift their leg further, and we would do it for them. So it's a passive movement, and we get them to say 60 degrees. Okay, perfect. Well, we know then that the sciatic nerve is starting to reduce in tension. The same principle applies with a slump test. If you're picking up the good leg and it's causing pain on the bad leg, again, just something to be a bit more wary of. No heavy lifting, no sitting for too long, just making sure we're taking as much pressure off that disc as we can. So those would be the 2 tests that I would try at home, just to give yourself a measure of where you're at. And then you can count these every sort of week, and just making sure that you're tracking your progress as you go through. Be really, really careful with those red flags, just making sure that you're monitoring those as you go through. If you have seen any GP or any A&E specialists, they will obviously tell you those as well. Really, really important we keep an eye on those. If you like the video, please hit the like button, share this with anybody who is struggling with sciatica, and subscribe to the channel. And as always, you can grab copies of my best-selling books here: The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and Transform Your Back. You can get these on Amazon, and I'll put the link in the show notes below. Thanks a lot, see you next time.